How long is it?
Let me say some things about death now in contemporary therapy. Contemporary times, many people who have begun to shock some of the cultural and religious beliefs of the past turn towards therapists for help with this. But are we therapists prepared to deal with this? You know, are we trained to recognize the presence of death anxiety? Are we equipped to offer something to alleviate it? I think when death enters the scene in contemporary therapy, many of us psychiatrists sort of heed implicitly. Of course, the dictum of one of the founders of American psychiatry, Adolph Meyer, who was chairman of psychiatry at Hopkins for so many decades. Adolph Meyer once said, you know, don't scratch where it doesn't itch. Don't scratch where it doesn't itch. Don't get into things you're not going to be able to offer any solution for. And I think in a sense we avoid that. The problem, of course, is that death itches all the time. It's always there. It's knocking at some interior door. It's whirring softly, barely audibly, just under the membrane of consciousness. Many patients may not complain overtly of death anxiety. It may be suppressed or camouflaged in ways that I'll talk about as we go on. If you ask contemporary therapists, does death anxiety overtly enter into the therapeutic dialogue? They'll say no. No, it doesn't. Patients rarely express concerns about death in the therapy hour. I'll give you a personal example of that. After I was at Stanford for about 10 years, and I mentioned, as David mentioned, I started to do groups of cancer patients, and later on David joined me and really performed some wonderful, meticulous research on these groups. But as I started to work with patients, I began feeling tremendously anxious. I could having nightmares. I wanted to be present. I wanted to be able to have patients talk to me very deeply about what they were going through. And I did that incidentally because I was writing about existential therapy, and I wanted patients to talk with me about it. And they never talked about it. I didn't know how to ask them and how to talk about it. I've learned how to do that now, but I didn't then. So I thought I will work with a client population that has to talk about it, people that have metastatic cancer. For the most part, I was working with metastatic breast cancer patients. So I was aware, as I began to encounter a lot of anxiety, I thought back on the fact that during my residency, I had a rather orthodox psychoanalysis 4 times a week on the couch, 700 hours over 3 years, and never once had the topic emerged. So I had to get myself back into therapy. It's when I began seeing Rolla May as a patient to be able to deal more openly with these issues. The other thing is that I think it's got to do with the therapist's readiness to deal with the topic. That will determine what the patient brings to the therapy hour. Patients don't voice concerns about death if they sense the therapist's discomfort. And what's more, therapists don't hear it if they do not wish to hear it. Maybe they fear igniting some of their own subterranean anxiety about this. And I think part of our preparation as therapists in dealing with this is to deal with our own thoughts of death anxiety and deal with it perhaps in our own therapy as well as our own inner meditation. But I think that if you're able to deal with this, and if you're able to develop some techniques, which I'm going to try to suggest to you in a few minutes, that I think that we have the ability to go with patients into these realms, and I think we have the ability to assuage, to a great degree, the terror of death that patients bring to us. But that's not all we can do. We can do much more than that. much more than simply assuaging anxiety. Um, I think there's a long philosophical tradition, which you're familiar with, I know, the idea that life and death are interdependent. Socrates, for example, talked about the fact that if we preparing for death is a way of preparing for life. So a concept that I've used throughout my writing, throughout this book, is the idea that though the physicality of death destroys us, the idea of death can save us. That's a strange comment. The physicality of death destroys us, the idea of death can save us. Save us from what? How save us? What I mean by that, of course, is that it can change the way that we live, that we can live more authentically. This was brought home to me in a stunning way in the group that David and I were leading. When I began to notice, we began to notice that patients that we had in our group did not all slump into a kind of numbing despair. That there were a certain percentage of patients, I think a substantial percentage, perhaps a third of the patients, seemed to change in the way that they lived in the world, and they talked about living differently and feeling differently. They described things like they're reprioritizing their priorities. They're stopped doing things that they don't want to do. They begin to say no to things that they didn't want to do. They began to want to spend time with the things that they really loved doing and the people they loved being with. They were more in touch with the changing seasons and the beauty of nature. And furthermore, they things that used to bother them didn't bother them. They weren't so concerned about not being invited to a certain party any longer. As one of my patients rather drolly put it to me, you know, Dr. Yalom, cancer cures psychoneurosis. And another one said to me at one point, and this is something I have never forgotten because it's been the foundation of what I was to do for many years. Another one said, what a pity it was that we had to wait till now that our bodies are riddled with cancer, to learn how to live. So I began to feel there's so much truth in that. How do we make people aware of this earlier in life, at a time when you're not actually facing death? So facing death for some was an experience that changed them. I'm using the term awakening experience. There's an old term in the literature that meant more or less the same thing, called boundary experience. In the older psychiatric literature, you'll find that. That's a poor term nowadays because we have other ideas and feelings about boundaries and use of boundaries. So I think awakening experience is a better term for that. And I think you're all aware of awakening experiences. They're very prevalent in great literature, by the way. San Franciscans, or all of you, are very aware of the Christmas Carol. American Conservatory Theater runs a play of the Christmas Carol every year for 3 weeks or so before Christmas. It's of course not a play. Dickens wrote it as one of his Christmas tales. And it's a classic story of a great transformation. Old Ebenezer Scrooge started the story as an avaricious, mean-spirited, greedy, cruel old man who everyone disliked, and then underwent a transformation and ended the story in quite a different fashion. Loved, charitable, generous, loving. Unfortunately, in the time of Dickens, psychotherapy had yet to be born, so we can't claim any credit for that. But Dickens was a superb master psychologist, and Dickens used a very potent form of existential shock therapy for Scrooge. You may remember that he sent him the angel of the Christmas yet to come, who escorted him into the future, who allowed Scrooge to see his final days, and to see his own death, and to see his strangers fighting over his bedclothes, and to see his own funeral almost entirely unattended, and to hear townspeople dismiss his death very lightly. And then finally, in the last scene, he was in the graveyard fingering the letters of his name on his tombstone. The next scene, Scrooge is transformed. That seems to be the critical event for his transformation. And there are many other great tales of transformation and waking experiences. It's also a core issue in War and Peace. So these are awakening experiences. But where are the waking experiences in our everyday therapy when patients aren't necessarily facing death with a fatal illness, or when you're not facing a firing squad, or you're not being escorted into the future? Well, I think there are plenty of awakening experiences available to us if we only take use of them. Many of them may be, what shall we say, nano experiences, but we magnify them and use them in therapy. One of them is grief. We work very well with grief, with the idea of loss and how we help patients deal with loss, and how we gradually, we've known this since the days of Freud and Abraham, we gradually help them detach themselves from the person who has died, detach their energies and begin to attach it onto life once again. So loss is an important part of them. An often overlooked aspect of grief is the confrontation with our personal death. If our peers, our friends can die, then so can we, so will we. You know, if our children die, the worst loss of all, I do believe, then in a sense our own symbolic immortality project has collapsed. If our parents die, then who is it that stands between us and the grave? So it has implications for death, and I try to work in that with my grieving patients. Other kinds of experiences, all the major life errors, children leaving home, and of course the midlife crisis, which is once the midlife crisis hits, and the ideas and thoughts about death are never far out of consciousness. The idea of the life era markers, people coming in with big birthdays. They're 40 or 50 or 60, we celebrate birthdays and there's always great parties, but if you really think about it through these existential spectacles, what's the celebration all about? It's really a confrontation with the inexorable, irreversible rush of time. So if we can get below that and help patients talk about what it means for them to be on schedule. And of course, nightmares are always dreams of death, anxiety, death terror, which is escape the corral which we keep it in during our waking life. And the life cycle of death awareness, too, is something to be kept in mind. It changes as we go through life. Children, much younger than some of us think, at the age of 3 and 4 and 5, we're doing a lot of silent research about death. They're thinking about it. They sometimes pose uncomfortable questions for their parents, but they notice that insects die, and leaves die, and pets die, and grandparents die. And then it seems to go underground. Maybe during the same years that Freud talked about a sexual latency, I think there's a death awareness latency. And it emerges again with force during adolescents, who are often pervasively concerned about death and death anxiety. And they will deal with it in a number of ways, many of them counterphobic, many of them moving into a kind of daredevilry, or taking risks, or taunting death, or, of course, attending in a counterphobic way horror films by the tens of millions. These are the people who go to see them. So I think I want to begin to talk about how do we deal with these things in therapy, in psychotherapy. I think that in dealing with death, anxiety, we use a combination of factors that we use in all forms of doing deep psychotherapy. We offer patients two major factors. We offer a synergy of powerful ideas and a powerful human connection. Those are the two things that we have to offer patients, and it's certainly true for this form of psychotherapy too. I'll talk about each of them, and then I'm going to end this talk by giving you a couple of long descriptions of two sessions that I've had with patients, which will illustrate them for you. So I'm going to just say something about the healing relationship, the connection. How does the existential factors that I've been talking about, how does that change the way we relate to patients? Well, it's changed the way I relate to patients in a very profound way. Again, I am not talking about patients with very severe psychotic mental illness. I'm talking about the everyday patients I see in longer-term psychotherapy. Do keep that in mind. But it does change it in that for me, it dismisses the last vestiges of a kind of model I used a long time ago with patients, where I am the healer. And dealing with these patients, these afflicted patients, with just some strange or odd disease that they have. Now, I change a whole lot towards them. I begin to eliminate the sort of boundaries between them and me. I begin to feel that we're all in this together, that I suffer from some of the same issues that they are dealing with. It's no longer them, the afflicted, and me, the healer. I realize, after all, we're all in the same boat. We all face the sense of our infinite smallness, insignificance when measured with the infinite largeness of the universe. So I feel that I have a different kind of connection and a different kind of compassion for the people I work with. So I try to help them, and I demonstrate too, facing as much truth as they can bear. So I strive personally in my work for openness and honesty with patients. I don't wear any kind of therapist uniforms. I don't deny that any of these dilemmas strike home for me. I don't refuse to answer questions if I feel that I can. I don't pretend I know things I don't know. I don't hide behind a wall of diplomas. So I said a little while ago, I'm going to demonstrate this with the vignettes that I'm going to mention. Let me turn to the other aspect of this synergy of connection and ideas. Let me talk about some of the ideas that we can use in therapy. If we talk about powerful ideas of therapy, some of them have been around for millennia. I'm very interested in some of the ideas, and I use them in therapy, of an ancient Greek philosopher named Epicurus. We know Epicurus often by this term, Epicurean food or drink or something. That's bizarre, because he was quite an ascetic in a way, but he was this interesting philosopher. I do think he's a very significant but often ignored ancestor of all of us. He called himself a medical philosopher. He said the goal of philosophy was to deal with the misery and anguish of human beings, just as the medical physician dealt with the problems of the human body. His goal was to minister to the human mind, to the human spirit. And what was it that is behind our misery? He felt that it was always the omnipresent existence, fear of death. He felt that it controlled so much of the way that we lived. He was born, by the way, let me just place him in time. He was born about 340 BC, born not too long after the death of Plato. And was one of the important Greek philosophers, had his own following. They often speak of the garden of Epicurus. That's the name that my book has, by the way, in Greece and also in France, because it was almost a kind of a cult where the students lived with him rather than came to study with him during the day. He felt that the anxiety about death was with us all the time, but not necessarily consciously. So I think in that way, he was one of the ancestors of Freud's view of the unconscious. He said we could guess at its existence through its disguised form, through, for example, exaggerated religiosity, through restlessness, moving from one place to the other, through a consistent accumulation of great wealth or blind groping for power. All of these, he felt, offered counterfeit visions of immortality. And he constructed a number of, I think, well put together ideas that his students learned almost as a catechism for dismissing or alleviating the terror of death. I'll just tell you about three of them today, because these three, I think, are things that are useful to me in my own thinking about death, and I've often talked about them with my patients. First one has to do with the mortality of the soul. So he insisted that the soul dies with the body. The mind dies with the body. This was a controversial view at that time. Remember, one generation before, Socrates, and it's well illustrated in the Phaedo, and one of the Platonic dialogues, Socrates very much believed that after death he would pass on to another kind of life, a much better life, once he's freed of the shackles of the body, where he'd be in endless discourse with like-minded philosophers. And Socrates and Plato's view of this afterlife, had a great rebirth in the Neo-Platonic literature and became one of the foundations of the Christian views of the afterlife. So Epicurus was taking a very materialistic view of existence. He says that if we're mortal, the soul does not survive, therefore we have nothing to fear in the afterlife. And the gods cannot hurt us there. And in a sense, that was very much relevant to the kind of religious leaders that were present at the time of Epicurus' life that were frightening the populace, that if they didn't live in a certain way and perhaps didn't give the proper type of gifts to the religious leaders, then they were going to suffer in the afterlife. So he was trying to alleviate that form of fear of the afterlife. And that kind of fear has been very relevant throughout many of our historical epics, certainly during the Middle Ages. Now, Epicurus did not deny the existence of gods. I mean, he didn't dare do that. Socrates had been executed only a generation before that. But he did say the gods were there. They were there on Mount Olympus, but they were totally oblivious of us. But they were important because they could serve as models for us, models of bliss and tranquility, and we should strive to emulate them. We should strive to achieve their type of ataraxia, blessed tranquility. When I was a resident, one of the first drugs that came out was called atarax. It comes from the Greek word for ataraxia. I think atarax is still around, as a matter of fact. A second Epicurean argument had to do with what he called the nothingness of death. He said once the body dies, the mind ceases to exist, that means our senses are dispersed. And that means we can never encounter death. So what do we have to fear? His famous aphorism that his students all memorized was, where I am, death is not. Where death is, I am not. It's the ultimate answer to Woody Allen's quip about death, which is, oh, I'm not afraid of death. I just don't want to be around when he comes. A third argument that I'll tell you about, which I personally, this has been debated endlessly in philosophical literature since then. Many people take strong stands against it. I think it's still got a lot of value. And he called it the symmetry argument. He's saying, in effect, that the state, if you will call it this, the state of non-being that will be in after death is the identical twin of the state that we were in before birth. It's the identical twin. And we have so much concern about the second one and so little concern about the first. I find that personally quite useful, and I've offered that to many of my patients. It's an argument that has been discussed by many people. Nabokov, the great Russian novelist, starts his autobiography, his wonderful autobiography called Speak Memory, which is, have you ever imagined a better title than that for an autobiography? Speak Memory. But he starts it off by saying, life is a brief crack of light between two eternities of darkness, the darkness before we were born and the darkness after death, right out of Epicurus. Let me go on. So those are three arguments over here. Let me describe another idea. I'll do it by telling you about a patient that I saw. A patient came to see me years ago, came from another country, wanted to work with me for about a week. She was a psychotherapist in midlife. She'd been suffering from a number of symptoms, great hypochondriasis. Any type of ailment that she's had, she's rushed seeing doctors. She's afraid it's fatal illness. And furthermore, she had a whole series of fears now. She was extremely risk averse. You know, that she used to be a good ice skater and gave that up and had to give up skiing. I was afraid to drive, and she had to take a whole handful of Valium to get on the airplane to come to this country. And it all began 2 years ago, quite precipitously. It began after the death of her mentor and very close friend. So we talked about this, went into it in great detail. I began to feel that these symptoms were gossamer thin manifestations of all death anxiety, of the hypochondriasis, the risk-averse behavior beginning suddenly after the death of a close friend. And in pursuing her awareness of death and a history of this, I asked her a question, which I almost ask all my patients who are dealing with this issue. It seems like a silly question, a simplistic question. In fact, so much so that I often will introduce and say, I'm going to ask you a very simplistic question, but just humor me on this one and answer it anyway. The question I ask her is, will you, Joan, call her Joan. Joan, will you please tell me what precisely is it about death that so frightens you? As I say, it seems like a silly question, but the answers are quite varied and I think quite informative. Her answer immediately was, all the things I would not have done. How so? And then she went on to tell me a long story about the fact that she was a very gifted artist. She was a prodigy, won a lot of prizes when she was quite young. But when she started a career of psychotherapy, earned a living, she gave it all up. No, that's not quite true, she said. Well, I haven't given it all up. The truth is, I start a lot of things. I start a lot of paintings, but I never finish them. I stuff them in my desk. I don't finish anything. I got a whole closet full of them. So I said, well, why is that so? How do you, you're so gifted and you start all these things, why do you not finish them? She said, well, it's money. You know, I have to earn a living. I see 40 hours a week. I said, well, how much money do you earn? How much do you need? And she said, well, I have expenses, 3 children in private school. In Britain, they call those public schools, just to confuse us. But they're private school. I have 3 children in public school. And then I said, and your husband, you said he was a psychotherapist too? Does he work also as much? And she says, well, yes, he works as many hours as I do. In fact, he does a lot of neuropsych testing, so he earns even more money at times because he charges more. So I said, well, then it sounds like you're making more money than you need, so what's the explanation for your not